Hello and welcome to the WHO social media talk show here at the 78th World Health Assembly. I'm Oyuntungalag Namjilsuren. I head the WHO's work on health information and advocacy. So today we will be discussing one of the most common and concerning issues for all of us about falsified medicines. We will be talking about why the problem exists, what may be the key causes, and what are the solutions we are coming up with. Studies show that in some places, up to 90% of the medicines that people are buying may be falsified or substandard. This is a major issue, so I have a number of guests here. So let me introduce my guests. Dr. Rutendo Kuwana is team lead for WHO incidents and substandard and falsified medical products. Professor Oksana Pyzik, Associate Professor of Pharmacy Practice and Policy at the University College London, and she also chairs an international coalition of organizations called Fight the Fakes Alliance. And we also have Dr. Obaidullah, who is Chief Executive Officer of the Drug Regulatory Authority of Pakistan. Welcome to the show. So I would like to welcome our global audience also your thoughts, opinions, and questions. Please type your questions with AskWHO hashtag on X and enter your questions in comments section on all of the other platforms on LinkedIn, Facebook, YouTube, from wherever you are watching us. So let's start the show. So let me start with Dr. Kuwana. I would like to share with the audience, what are we talking about when we say falsified and substandard medicines?
Thank you, Tonka. Well, I think maybe substandard is much easier to understand because it's a product which does not meet its standards of quality. But when we're talking about falsified, it's really, we're talking about a medical product or a medicine which is misleading in terms of what it contains, who manufactures it, and also maybe the quality part as well. So the source and identity of the product is misleading. So some people will call them fake, some people will call them counterfeit. So it's really the same. The way we say falsified is really in a legal term, for the purpose of professional and understanding globally, but otherwise it would mean the same as counterfeit and fake products.
So can we say just simply fake drugs?
Yes, we can.
Thank you. So as I mentioned in the intro, in some places up to 90% of the medicines that could belong to this category, which is really worrying. And it is also a question about people really having that confidence and trust in our pharmacies and health services, because people are buying these medicines with their own money. What is the extent of the problem globally and in some of the regions as well?
It is a big problem, and in some instances, just like what you're saying, we estimate that 1 in 10, for example, for every 10 products, maybe one of them is either substandard or falsified, especially to those countries where the low-income countries. And we estimate also that maybe about $30 billion is actually wasted on buying these products which are substandard or falsified. So it's really a waste of the very finite resources that we have.
Okay, so I'm going to turn to you, Professor Oksana Pyzik. I know you work to raise awareness and also safeguard public health. Could you please explain why this is a public safety issue and what are the clear examples that we can think of when we are talking about this problem?
So I'll start with an example of substandard products, which over the last few years there have been tragic mass poisonings within children's cough syrup. As the story of Irfan, who is just 2 months old in the Himalayan region in India, his family walked 10 kilometers to get to the closest pharmacy and pick up some cough syrup. Inside that cough syrup was something called diethylene glycol, or DEG. This is an industrial solvent, and it's used in things like brake fluid, antifreeze solutions, and it definitely does not belong in pediatric cough syrup. Over the years, we've had repeated cases of such tragedies where this child ended up in hospital, not being able to breathe, and eventually passing away from kidney failure. And this tragedy has still not been resolved. Children like Irfan, there have been cases in the Gambia, in Uzbekistan, in Iraq, in Indonesia, and 15 other countries that WHO has investigated. Unfortunately, there are probably many more cases, but they're hard to find and hard to prove. So that is an example of how medicines can have either excipients or the active pharmaceutical ingredient that are not up to quality, that are contaminating the product, and it costs human life. We heard that statistic, 1 in 10 medicines on average can either be substandard or falsified. That's 1 in 10 times that we gamble with human life. Now, that type of story is more common in low-income settings, but in high-income settings, what we're seeing a different type of trend with falsified medicines. And the way to distinguish that is sometimes criminal intent. There is no legal manufacturer creating it. We don't know who's even making it. And this is a prime example of people going online to get medicines from illegal pharmacies. So we've heard a lot in the media about things like Ozempic or the weight loss jab, and a very sad story in the UK. So that's where I work. And a lady had purchased a weight loss jab on a social media website, but it didn't contain semaglutide, which is the active ingredient. It had insulin. She collapsed in front of her children and was rushed to hospital via ambulance, where she had such severe hypoglycemia that she almost died. Luckily, she did survive, but she is now warning everyone in the UK that you should not be buying any type of medicines off of social media, or if you're going to an online pharmacy, you need to check that it is legitimate. It's a legal online pharmacy with a prescription. So those, I think, can help us distinguish between the problems, and it's everywhere. It's not just in low-income countries. We have different types of problems, but still causing patient harm all over the world.
Thank you. I mean, this is an incredibly serious issue. We are really talking about human loss of life and a major, I'm sure, business there. But I'd like to turn to you, Dr. Obaidullah. You're the Chief Executive Officer of the Pakistani Drug Regulatory Authority. And this is the type of government agency everywhere in all of the countries people really put their trust in so that you can protect us, the populations, to access safe and quality medicines. And I also realize the mention of the contaminated syrup outbreaks in multiple countries also involved Pakistan. So from the real ground, from the country experience, what are the key reasons that we are really having these problems?
Thank you very much, Tunga, for having me in this live session. In fact, the problem of SF medicine, it's not the localized problem, because medicine is an international commodity. If any medicine is being manufactured in any country, it is not being manufactured for that very country, it is exported. And the examples which have been shared by our colleague, these are not the medicines which were manufactured in that very country where it was used. So, and it was manufactured in some other country and then exported. So international harmonized legislations and regulations are very much integrally important to combat this issue of SF product. As far as my country is concerned, over the past 10 years, there was a tremendous improvement in the regulatory system. We have been transformed from the conventional system to international harmonized regulations. And if we see that we are working for the maturity level 3 of the global benchmarking tool. And out of 9 regulatory functions, there are 2 functions which specifically talk about this one, and that is the market control and lab testing procedure. So by and large, these are the problems. If any country want to overcome the issue of SF product, it is the right approach to have the internationally harmonized legislation on the terms of the benchmarking tool, so that it's a structured mechanism can be done and it can be adopted for the resolution of the issue, and it is the solution. And if my country is concerned, now we have transformed our system from the conventional to all these components of indicators of all these components. Now we improved our testing. Out of our 11 public sector laboratories, 6 are WHO pre-qualified and rest are being done. At the same time, specifically talking about this very issue of DEG and EG, Pakistan was the first country who issued the Rapid Alert Advisory. And all these things, and at the same time, followed by the 4 other advisories. And at the same time, we made it mandatory that all the DEG and EG to be used in pharmaceutical product should be tested by government lab. And by all these actions, Pakistan was successful that not a single case of any death has been reported, not inside Pakistan, but rather for the exported products as well. So these were the regulatory mechanisms which we adopted, and by virtue of which Pakistan has we have done very efforts so that we can't have any product which we can say that it is the DEG or EG have been contaminated for that.
Sounds very promising, but I also want to just go back to one of the statistics that you both mentioned, that it's a huge amount of money that is spent. You mentioned that there's at least $30 billion that these medicines cost just in low and middle income countries. So in terms of just money size, especially here at the setting of the WHA, where we are discussing the WHO budget, that is already 7-fold of the budget that the entire WHO is spending on. So there's a massive amount of business, and I really want to go into a little bit of the commercial determinants side of it. What kind of business is this, and what are the key players? My question to you, Professor Pyzik.
So you mentioned that it costs the health sector over $30 billion to respond to all the healthcare needs as a result of substandard falsified medical products. But it's also very lucrative to the whole falsified sector. It's sometimes described as the perfect crime because it's a high profit with very low risk, because we don't have that harmonized international legislation to apply tougher penalties, disincentivizing the profit. It's an over $200 billion market in terms of financial reward. That's more than illicit drugs. So if you look at it from the organized criminal perspective with falsified medicines, this is a lot of money to be made, and countries haven't caught up with each other in terms of how to appropriately respond to it. So wherever we see falsified medicines, usually this is because there's a big demand, right? So the market drives it. So during COVID, what did we see? Lots of falsified COVID-related products. Everything from diagnostics, PPE, even falsified vaccines. Now, because there is such an interest and probably unprecedented media hype around weight loss jabs, this is another area where there's a lot of falsification. Any environment in which medicines are very expensive, or there is a shortage due to natural disasters, conflict, all of these things mean that there's higher risk for penetration within the legal supply chain of falsified medical products. And this is where the organized criminal groups target, because that's where the money is to be made.
You both mentioned that there is really a need and also opportunity to generate global scale regulation. And I'd like to turn to you, Rutendo Kuwana. What is WHO doing? What are the key priorities for WHO in this area of work?
So as WHO, we work in 2 different main ways. We, of course, being the World Health Organization, we coordinate and we convene member states so that they can collaborate, as mentioned by my colleagues here. So we have a member state mechanism which was established in 2012, which is really the countries coming together to talk about it, to try and identify what are the causes, what can be done to prevent, what can be done to detect, and also how member states or countries can actually respond proportionately to this continuing situation of substandard and falsified medical products. In addition to that, we also have a reporting system which we manage, which we call the Global Surveillance and Monitoring System. So in each country, we have at least one representative, which we call focal point. They report to WHO, and we help them to investigate if they don't have the resources. And on the basis of what they would have reported, we also then share this information with the countries, especially those countries that are impacted. You mentioned several countries, and also when we were working with our colleagues, for example, from Pakistan, whenever they report to us products that are in international commerce, they tell us that we have this product, we bought it from there, it has been distributed to these countries. Our job as WHO to make sure that we provide that information to the countries, and also, of course, to help them with the regulatory systems, to improve the regulatory systems so that they can actually adequately have the oversight.
So WHO collects the information whenever there is and wherever there is an incident of unsafe medicines to generate this alert so that globally in different territories, people, pharmacies, doctors are informed about what might be a potential outbreak, which is really great. But I also want to understand from you, Dr. Obaidullah, there is a major role for internet. A lot of people buy medicines online, and it was mentioned that many of these medicines also are encouraged, the sales of those medicines are encouraged by this medicines and sales through the new technology. How do you see the problem in your country?
In fact, it's a very important problem which is now emerging, because when on one side technology has a good aspect and beneficial aspect, so every technology has some bad impact as well. And internet sale of drug is one of the component where we really want to work, not only on the level of our any national government, rather at international level. It is a very important problem which is being spread across the globe, and most of the cases, rather on all cases of internet sales, are not being regulated by any country, because still legislation is to be done by every country for the internet sale. And I was just discussing with Rutendo that in the next World Health Assembly, we must have some resolution to curb this thing. And Pakistan can be one of the sponsors for this resolution as well, because it is an area where not only developed countries, rather LMICs, they are still struggling for this thing. And all the drugs which Professor has just shared, Ozempic and so many other drugs, the major source of these falsified medicine is the internet medicine. And it's not restricted to this one, falsified medicine. This internet sale is one of the biggest source for the addiction and for those drugs which have been banned by their countries as well. So we must think, all member countries should think, WHO should take the lead and should take member state as well on confidence to legislate the component of internet sale. And for all those countries which are not developed yet, they should ban all the internet sales. And it is not the regulatory authority alone, because it is a cross-border sale. So custom authorities are also part of that, and enforcement to be done by some law enforcement agency. So it is tripartite action, legislation in any country, national regulatory authority, custom authority, and law enforcement authority. They should be the part of this internet sale ban, and I think there should be some model legislation by the WHO or UCL or some other institutes can take lead for this one.
Thank you for that. So I'm going to remind our viewers from wherever you're watching, you can participate in our discussion. You can type your questions with Ask WHO hashtag on X and on all of the other channels, LinkedIn, YouTube, and Facebook. You can enter your questions in the comments section. So let me read out a question from a viewer. Geek Gatito is asking the following. What are the most pressing global health challenges the WHO is focusing right now to deal with this problem? And how can individuals help support public health initiatives related with fighting the fake medicines or the substandard and contaminated medicines? Your thoughts?
So maybe I could speak on behalf of WHO. What is happening is, especially this issue of the contaminated syrups in children, the problem starts from the raw materials that are used, and that's where the contamination was. So we are working with the governments, and we're also working with industry to make sure that there's adequate control of the raw materials, because bad material coming in, you get a bad product which can be very dangerous as well. The other thing which Dr. Obaidullah mentioned is the issue of narcotics, those hard drugs that you find on the street. We have recent evidence. This is a worrying development that medicines that are on the street, your ecstasy, your mandrakes that people are used to, fentanyl and so forth, we have found recent instances where they are being adulterated with other very, very potent, highly toxic narcotics as well that have no medicinal value. This is an emerging trend, and it's now not only low to middle income countries, but also the well-to-do countries are impacted. Recently in Switzerland, we had a case which we also listed on our medical product alert. So a lot is emerging, and we really need to take this seriously. And the other thing which I want to mention is with regards to the users of the products. If you demand quality, you will get quality. If you do not demand for good quality product, you'll get bad quality product. So it depends on the users of the products. You have to ask for it. And that's one thing that I would urge the viewers, the public in general, to make sure that we do that.
So as an academic and pharmacist, I would say that if you're unsure, if you're looking, because there are lots of legitimate digital health sites that offer services, that speak to your pharmacist first, and they can help guide you in terms of getting online services. So that would be one. And also if you hear from your friends or other people who are going to social media sites to purchase, that will never be a legitimate product. You have to understand that social media does not have licenses to sell medicines. You need a prescription, and if you're unsure about where to go, then definitely speak to your pharmacist and join the Fight the Fakes Alliance. So we're on Twitter, LinkedIn, all the platforms. Share our message that to fight the fakes and get your medicine safely. We're not going to escape the consumer trends in terms of people getting care online. And there's many benefits to that in terms of places that are remote, but you need to be doing that safely. And even our healthcare professionals don't always know how to verify. So that's where the education and the awareness comes in.
Thank you. Any thoughts?
I will continue from my two other colleagues. I will have two perspectives being National Regulatory Authority Chief. One perspective is definitely from the public perspective, and definitely I will go by the comments of my other colleagues as well, that public should go and buy the medicine only and only from the licensed pharmacies. That is the only source of having the quality drug. No online sale, no internet sale, or if any consumer or patient find that any pharmacy is giving some higher discounts of any medicine, it means there is the problem. So inform the National Regulatory Authority. It is the perspective of the patient. I have another perspective as well, and that is for the manufacturers, pharmaceutical manufacturers. As per the guidelines, every manufacturer is supposed to have three sources of any active pharmaceutical ingredient or excipients to be legitimate supply. But in some cases, we also found that excipients are being purchased online as well. And that is the typical example for the glycerine and glycol as well, that was contaminated with the DEG and EG. So it's not only the patient who should comply and should not go for internet. Other pharmaceutical manufacturers are also supposed to have purchase the medicine ingredients, both active pharmaceutical and excipients, from their approved vendor. In fact, Pakistan has conducted a study as well with the help of the WHO, and we found some cases, and we then banned those cases, and now we are publishing that one. And that is not the problem of our country, it is an international problem.
So it's not only just the medicines that exist online, but also the producers in some cases, they buy their raw materials online, which could be the source of the problem. That is really interesting. I have another question from Amija Ahmed. I think she's from Sudan. How Sudan is full of falsified medicines due to ongoing war. Now Sudan, sorry, not how. And what kind of campaigns and measures would be possible in this very challenging setting?
As WHO, we actually did some campaigns, and I think Oksana did mention the issue that for people to do something about anything, they need to be aware about the scope, the scale, and the harm that can be caused by whatever it is that you want to prevent. So we did some awareness campaigns in some countries in Africa, and what was important was to be able to share the message that substandard and falsified medical products or medicines are real, they are harmful, and also what you can do about it. And my colleagues have mentioned, speak to the pharmacists, manufacturers, what should they do? So awareness campaigns at community level, radios, and what we are doing now, these are the things that we would recommend. And also, for those people that are now aware or are aware, we ask them to spread the message, join Fight the Fakes.
And I think, in that context in particular, Sudan has been a region that has seen a lot of conflict, and that's why it's more vulnerable, which means there needs to be even more investment in supply chain security. And as my other colleague has highlighted, it's at every point in the supply chain, there has to be that education and training. So the public needs to be aware, but border control needs to be aware, law enforcement needs to be aware. Knowing that you can trust the wholesalers, knowing that you can trust the people who are supplying the excipients. So not to go to the heavily discounted, unknown vendor because you don't know what you're getting. And already an excellent point was made by my colleague that if the discount is too good to be true, you're probably going to be getting something that isn't safe. So at the end of the day, we have to be even more vigilant when it's in a conflict setting where medicine supply is disrupted. Often in those situations, you have foreign aid playing a huge role, but the local supply chain also needs to be protected.
So I have a question from Suchismita Roy, and I will try to summarize her question. It's a little bit long, but she's asking, what is WHO doing to convince Asian national governments with large populations to allow quality medicines? Because she thinks that through the tendering system in some of the South Asian countries, only low-priced medicines are prescribed. And she feels that in doing so, a majority of a proportion of the population is not really getting access to high-quality medicines. So she's basically asking about the tendering process that many of the governments use and how can the quality be assured.
I think to a certain extent, my colleague Dr. Obaidullah also mentioned this with regards to the procurement. When you're procuring medicine, price should not be the only determinant. You should also consider the quality of the product. You should demand for quality. It must be one of the requirements that the product must come from an appropriately registered manufacturer who complies with the international standards for manufacture, and also that the quality is assured, testing is adequately conducted, and the product is approved by a competent national regulatory authority. So the tendering process is really to take advantage of economies of scale. So it does not mean that because the price is low that the product is poor quality. And some people use the name generic. Generic medicines are not substandard or falsified products. They're just copies of maybe the original products, and by the nature of the products, they tend to be manufactured at a lower cost, and therefore they become available, not necessarily because being generic, they are of substandard quality.
I mean, I'll jump in by just saying that we have both generic and branded medications that are falsified. So really both can be targeted. And we shouldn't operate under the assumption that generic is low quality. That's not the case. You can get an excellent price point. India being one of the pharmacies of the world, if you will, and also a leader in generics manufacturing. That's really important in terms of medicines access. If we look, one of the root causes of this problem is, again, when medicines are not affordable, this is where the falsification occurs. Because people cannot afford them and another actor steps in to try and provide that. So we need to have access to affordable and quality medicines. And if you operate in an environment where generics have the appropriate inspections policy in place and the regulatory bodies are doing their job and checking that that standard is met, that's actually a really wonderful achievement for public health and is able to provide access to medicines to many more people in the world.
It's a very important point that the generic medicines is a type of medicine that could be at a lower price, but is of good quality if it's properly, supplied and regulated. So it's not exactly the same thing. I mean, it's actually a completely different thing from substandard and falsified medicines. I think it's a very important point because in a lot of public health programs, actually, generic medicines provide the backbones to improve the coverage of the services. So an interesting comment somebody put, actually, it's Mihail Oras put on X that falsified medicines are like bad movie sequels. So it is good. That's an interesting comment. But it's probably not exactly directly related with falsified medicines, but Obaidullah Avan is also saying there's a problem with people using antibiotics and lots of other prescription drugs even without much counseling. So there is really this communication with pharmacists, not only just about quality, but also how to use and treatment schedules and such is a problem. So what's your opinion on that?
In fact, antimicrobial resistance is a very big issue, and it is not, it's not a localized issue. It is an international phenomenon which is being prevailed. And sale of drug on prescription is very important for all the drugs in general and antibiotics in specific. So in my understanding, every national regulatory authority should legislate and should implement that prescription should be followed and drugs should be sold on prescription. For that purpose, WHO has an aware list: access, watch, reserve. Antibiotics have been divided into 3 categories, and for that purpose, legislation should be on this pattern. Every government should take steps so that antibiotics should not be sold without the prescription, because these are not candies. Antibiotics and drugs, these are the prescription drugs which should be sold under the supervision of pharmacists and on the prescription of registered medical practitioners. And it is a very big issue again in LMICs.
It's a really important point about antibiotics. It's not necessarily on the falsified nature, which is a slightly different issue, but just generally, antibiotics are not supposed to be taken without prescription. And I think this is a message that really needs to travel far and wider, everywhere. So there is a question from Ayun Aluk, who's asking, and it's really raising the major issue, that is the really kind of a root problem in the health services, which is how can we trust our pharmacists? Because we go to our pharmacists, to pharmacies, and they give us medicines and we take them. But if the medicines are not genuine, which is happening in a lot of the African countries, what can we do? So I think that's really the key problem that we are discussing here.
In fact, every country has national regulatory authority, and every national regulatory authority has offices in every city almost. So it is required there to inform that very localized office. It is one way. But now with the advancement of technology, it's very important to use the technology interventions for reporting of any falsified medicines. By the way, we are working on that forum as well, and soon Pakistan is introducing 2D barcode with the QR code systems, so that every person who is purchasing the medicine, they will scan the product, finished product, and if that is genuine, they will get the medicine message. But if the product is falsified, then message will be conveyed to the National Regulatory Authority with geotagging that this product is available at such a place which is falsified, and National Regulatory Authority can take the action. It is one of the points where we can work with the endorsement of technology.
So I'm going to raise this point that the falsified medicine is actually not really some kind of theoretical or conceptual problem. It's really about everyone who's taking medication today, which is happening, which is all of us. So if somebody has an issue or a question about a possibility of falsified or substandard type of medicine, what should the person do?
So again, I will say that you should bring it up with your pharmacists. We're actually helping train individuals to be able to report to their national regulatory authorities so that we get more reporting. That also helps us understand the picture better. But anything from, it could be that it looks, it's dissolving more easily. It's not as crumbly usually, this tablet. Something like that. Bring that up with your pharmacist, have the conversation, because then they can help you to check where has it come from, is this batch been recalled, and even if it's not a substandard or falsified issue, sometimes you even just have things like recalls. So I would say if there's any suspicion at all, damage to the packaging, if the color of the tablet is different, if there's spelling errors on the product itself, these are all clues. So you should be examining, particularly if you're in a region where there's a higher burden of substandard falsified medicines, you need to be alert, you need to be aware, checking those products, and if you're unsure, do not take it, bring it to your pharmacist. They will help to verify, and that's the beauty of the technology that we have these days for tracking and tracing, for GS1 standards, to be able to ensure that we know everywhere that this medicine has been moved, and to verify the authenticity of the product. So in that instance, I would say right away, have a conversation with your prescriber.
So this is great because it actually, the main message is that you can do something. So you do not have to sit idly and do nothing. You can actually think about it and start having conversations, maybe learn about the National Regulatory Authority as well, now that you know that this might be a problem in many of the places. So now here at the WHA, we have this topic on the agenda. Right at this instance, and from Monday onwards, the countries will be discussing this topic. So I'd like to maybe wrap up, just hearing your opinion about what should be the priority and why this is important right at this very instance.
As WHO, I think one of the major things is collaboration and sharing information between the countries, improving awareness and embracing technology, the track and trace technologies that have been mentioned, also the technologies on the field to be able to detect these medicines. So this, I think, should be the priorities going forward.
So I would encourage all member states to collaborate with the Fight the Fakes Alliance to help achieve the WHO's mission on prevention, detection, and improving response and reporting of these products. And also that we get the general public involved, aware, making sure that they're not going to social media sites, and if they do find them, that they report them. I would urge that member states and countries also put some pressure on the technology companies that platform the sale of some of these falsified products. They have an accountability in this piece too, and I'd like to see them to be part of the solution. So education, awareness, and from a legislative point of view, we need to disincentivize this. This is a serious crime, even with substandard products. There's when the contamination is to the extent of mass poisoning, there's a legal argument around criminal negligence, and we need to have accountability. The victims deserve a recourse for justice for the loved ones that they have lost. This affects real people, real lives, and fake medicines can cause real harm.
In fact, SF product is a real threat to the public health. And it is one of the priority area where WHO is working since long, and that's why it is in the agenda of World Health Assembly. Being a national regulatory authority, it's my pledge that WHO should work for the regulatory system strengthening of the member countries. It is the only solution by which we can work together, we can eliminate the component of this SF product, and we can strengthen our regulatory system. And another thing is, which is very important, it is a regional coordination. And this regional coordination should be done by WHO field regional offices for the strengthening of their regulatory system in those member country. It's not essentially required that if any country which is developed that doesn't require regulatory system strengthening, because it's a continuous improvement process and it should be done, strengthening should be done, good governance in medicine should be done, and collaboration should be done to eliminate this problem of SF product.
Thank you to our viewers from Cameroon, India, Senegal, Qatar, Ethiopia, Brazil, Cote d'Ivoire, Ireland, Sudan, South Sudan, United Arab Emirates, Somaliland, Ghana, and lots of other places. And thank you to my guests today, Rutendo Kuwana, Oksana Pyzik, and Dr. Obaidullah. We wish you a very good day, and till next time, goodbye.